Imagine waking up with the worst toothache of your life. Your face is swollen, you barely slept, every heartbeat feels like someone is hitting your tooth with a tiny hammer. So you go to the dentist, except there is no dentist, no x ray, no drill, no numbing injection, and the man who may end up pulling your tooth might also be the man who cuts your hair. For much of history, tooth pain was not something you booked an appointment for. You endured it, you tried to treat it, and if nothing worked, eventually, someone had to get that tooth out. Humans have been extracting teeth for thousands of years. Ancient medical writings describe tooth removal, and archaeologists have even found ancient forceps. But extraction was dangerous. It was difficult, and usually, it was a last resort. Before modern anesthesia, there was another obvious problem. It hurt. A lot. So people first tried almost anything that might stop the pain without pulling the tooth. In medieval England, medical texts describe herbal remedies, powders, charms, and even amulets for toothache. Some treatments included bloodletting. And behind many of these remedies was an idea that survived for an astonishingly long time: the toothworm. For centuries, different cultures believed that a tiny worm living inside the tooth could cause decay and pain. If your tooth was throbbing, perhaps something was literally inside it, gnawing away. It sounds ridiculous now, but imagine living without microscopes, without an understanding of bacteria, and with a mysterious pain deep inside your tooth. A hidden creature probably did not sound completely impossible. People tried different ways to drive the supposed worm out. Historical accounts describe fumigation and various folk remedies. Unfortunately, the worm was not real. The pain definitely was. And when those remedies failed, you needed someone willing to pull the tooth. That person was not always what we would call a dentist. In late medieval Europe, barber-surgeons did much more than trim beards. They could perform bloodletting, minor surgery, and pull teeth. Depending on the place and period, tooth drawers could also be traveling specialists, apothecaries, surgeons, and even people from other trades. Picture the experience. You walk into a barber shop because your tooth has become unbearable. Around you are shaving tools, bowls, and surgical instruments. You sit down. There is no electric dental chair, no suction, no local anesthetic, and no comforting voice telling you. You'll only feel a little pressure. Someone takes hold of the tooth with an instrument and starts pulling. Historical artwork even shows tooth drawers performing extractions publicly at markets and fairs, sometimes surrounded by crowds. Tooth pulling could become a spectacle, which means that on one of the worst days of your life, you might also have an audience. And the tools were not exactly the precision instruments used today. Early extraction instruments evolved over centuries, but the basic objective was brutally simple: grip the tooth, loosen it, and remove it. But extraction could go wrong. A tooth could break, roots could remain, nearby tissue could be damaged. And before modern infection control, antibiotics, and reliable anesthesia, every complication mattered much more. Still, dentistry was slowly becoming more sophisticated. By the 18th century, people were doing far more than simply pulling teeth. Practitioners performed fillings, scaling, artificial tooth work, and other treatments. And in France, one man helped turn scattered dental knowledge into something much closer to a profession: Pierre Fauchard. In 1728, Fauchard published Le chirurgien dentiste, the surgeon dentist. It is widely regarded as the first comprehensive work devoted to dentistry. Instead of treating dental knowledge as a collection of secrets, he organized and published information about dental disease, treatment, instruments, and techniques. This was a huge step toward modern dentistry, but one enormous problem still remained: pain. Imagine having increasingly sophisticated dental procedures while still lacking reliable anesthesia. Then, in 1844, something strange happened in Hartford, Connecticut. A dentist named Horace Wells attended a public demonstration of nitrous oxide laughing gas. At the time, nitrous oxide was also used as entertainment. People inhaled it at public exhibitions and behaved strangely while audiences watched. During one demonstration, Wells noticed that a man injured himself while under the effects of the gas, but apparently felt very little pain. Wells immediately saw something more important than entertainment. Could this stop the pain of dental surgery? The next day, He tested the idea in the most convincing way possible, on himself. Wells inhaled nitrous oxide while another dentist extracted one of his teeth, and it worked. He reported experiencing remarkably little pain. Think about how absurd that moment is. For thousands of years, humans had dealt with dental pain using remedies, charms, crude procedures, and sheer endurance. Then a dentist watched people getting high on laughing gas at a public show and realized it might make tooth extraction painless. Wells began using nitrous oxide for dental extractions. His later public demonstration in Boston went badly when a patient cried out during the procedure, damaging Wells' reputation at the time. But the underlying idea was correct. Anesthesia was about to transform dentistry and surgery. Within the following decades, dental practice became increasingly professionalized. Better instruments appeared, dental schools developed, anesthesia improved, knowledge of infection and disease advanced, and eventually, the terrifying tooth puller with forceps evolved into the dentist most of us recognize today. So before dentists, who pulled your teeth? There was never one answer. Sometimes it was a surgeon, sometimes a specialist tooth drawer, sometimes a barber-surgeon, and depending on where and when you lived, the person dealing with your tooth could have a very different level of training. But the real difference between then and now was not simply who held the forceps, it was everything surrounding them. No modern anesthesia, no x-rays, no antibiotics, no modern sterilization, and far less understanding of what was actually causing the problem. So the next time your dentist tells you that you need a filling and then reaches for a tiny numbing needle, remember, for most of history, that needle would have looked like the good news.